Welcome everyone. Thank you for joining us today. I'm Teresa Marantet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Today we are reporting an increase of 47 new cases of COVID-19 in Windsor and Essex County. 25 are close contacts of confirmed cases, 5 are community acquired, 1 is outbreak related, and 16 are still being investigated. We have had 15,292 cases since the beginning of the pandemic. 482 people are active at this time, with 149 cases having the variant. 806 preliminary or confirmed variants of concern have been identified in Windsor-Essex County, with 90% of these cases having the UK variant. We've had 2 cases with the South African variant. 20 people from Windsor-Essex County are currently in the hospital and 5 people are in ICU. Our community has lost 414 people to COVID. Unfortunately, we are reporting an additional death due to COVID. A man in his 50s from the community has passed away. There are currently 14 active outbreaks in Windsor and Essex County. 10 in workplaces, 1 long-term care home, 2 schools, and 1 in the community. Regarding our vaccine update, 155,183 doses of a COVID vaccine have been administered to Windsor and Essex County residents. 141,554 people have received at least 1 dose. I'd like to provide an update on our eligibility for vaccination when booking at one of the mass vaccination sites. So first of all, let's begin with those living in a hotspot postal code area. These are neighborhoods where your postal code begins with N8X, N8Y, N9Y, N9A, N9B, N9C, and N88. If you are 40 years of age and older and living in a hotspot area, you are now eligible to book an appointment. When you go to book online, you will see an option that says Hotspot Postal Code 40+. Click on that button and you can begin the process. Please bring proof of your address to your appointment, such as a driver's license or a current utility bill or other bill. And remember, transportation to and from a vaccination site is free through the Windsor-Essex Regional Chamber of Commerce. Please contact Vets Cab in Windsor or Sun Parlor Taxi in Leamington. As well, Transit Windsor is offering free bus service to mass immunization clinics as well in Windsor. Another change that you will see is that people 40 years and older having an at-risk medical condition will also be able to schedule an appointment. These health conditions include autoimmune disorders, stroke, diabetes, and those diagnosed with a mental health or substance use disorder. Again, if you are booking online, you will see an option that you can click on saying at-risk medical conditions 40+. We are also booking those people that are working in a licensed child care setting. Another option has been added to our online booking system for this group specifically. People will be required to bring a letter from their workplace to the appointment. We continue to vaccinate people 60 years of age across all vaccination sites for the general population. If you are booking online, please go to wevax.ca, or if you need assistance, please call 226-773-2200 and someone will be able to help you. For general inquiries, please call 211. We would also like to remind residents that individuals 40 years of age and older may be vaccinated at one of the participating pharmacies in Windsor-Essex County. Please see our website for the map of pharmacies. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning and thank you for joining us again today. COVID-19 continues to infect people and take lives around the world and in Ontario. We already reported 1 death in our community today, and we all are aware that our region is identified as a hotspot for COVID-19, and that's why it's important for us to remember that how quickly our case counts can jump and could lead to more people dying. My heart broke down when I read the news about the 13-year-old girl from Brampton who died of COVID. As a parent myself, I cannot see my child in pain, and I cannot imagine how painful and devastating it must be for the family who lost their daughter. A very, very strong reminder for all of us not to take this disease lightly, and please do not let a tragedy teach you how deadly it can be. Please continue to follow the public health measures. Get the first vaccine that's available to you. We continue to add more vaccine priority group in the list just to make sure that our community continues to get the vaccine as quickly as possible. Anticipating additional supplies of COVID-19 in the coming weeks, we have already added additional priority group based on the provincial priorities as well as local epidemiology. I want to request our community please to do not falsify any of the information and register only if you meet the criteria to make sure that the vaccine goes to the right people. We will get to each one of you as quickly as possible. All these vaccines are for the residents of Windsor-Essex, and we want to make sure that it is distributed in an equitable way and in a timely manner with all the priorities identified as quickly as we get the vaccines. Thank you.
We'll now take questions from the media. Today we'll start with CBC.
Hi, good morning. Today the province lowered the criteria for vaccinations in hotspots to 45, but we're doing 40 and above. Is that because of the recently announced increase in vaccine supply? Just wondering how we were able to move ahead there.
Well, we are looking at our local data as well. We have our local vaccination coverage rate, and dropping it down to 45 is helpful, but not enough to get the numbers that we are hoping for. And with the additional doses, we do have additional vaccines that we can open it up. We know that these hotspots are hotspots for a reason, and a lot of these cases of COVID are coming from that region. So we wanted to make sure that we provide the level of protection that we can for individuals living in these hotspot areas.
Thank you. And I know yesterday, Doctor, you spoke about the risk of people who previously had COVID-19 becoming reinfected. And my apologies if this question was addressed, but how many cases are you aware of locally where that has happened?
Well, I don't have the full number in front of me, but it's a handful. It's not a lot, but it's just a reminder that people still need to continue to take precautions. Some of them are like long time ago, but it doesn't mean that even if someone who had maybe a regular COVID or a SARS-CoV-2 virus, and then they could again be infected with a variant of concern. So we don't know all of these details yet in terms of the level of protection and the immunity that can provide, but it is important that we know that there is a possibility of reinfection as well. So people should be taking precautions when they're out, and especially if they have any symptoms. If their symptoms meet the criteria for COVID, then they should get tested and make sure that they're keeping themselves safe and everyone around them.
Thank you.
Any questions from Blackburn?
Not today, thank you.
Any questions from the Windsor Star?
Yes, good morning, Doctor. Good morning, Teresa. Do you have an estimate of how many people you are now opening the vaccine up to?
Good question. I used to have that number, but I don't at this time. But we know these 7 hotspots in total that constitute roughly around 40 to 45% of our entire population of Windsor-Essex. So it's a pretty good chunk, and we are breaking it down by age just to allow these people to register and receive the vaccine. Yeah, I don't have that number in front of me, but as I said, typically that's overall 40 to 45% of our entire population.
Do you have an estimate of how many people in Windsor-Essex fall under the at-risk category?
I don't. I think it's a very difficult number to collect, and there is no systematic way to collect that information. We anticipate that would include a large group of people, but it is important that people understand that it's not a self-diagnosis. It has to be diagnosed by a healthcare provider, and for which they are seeking regular medical care for that condition. And it's important that people know that. And I know some of these criterias or some of these conditions are loosely defined, but people who have those conditions, they know how it's diagnosed and how what kind of treatment that they're receiving. So it's important that they follow these criteria and priority based on the diagnosis made by their healthcare provider.
What, if anything, needs to be done at the mass vaccination clinics to expand capacity to accommodate such a large group of people?
So we obviously, as we have always said, we have the capacity to increase the number of vaccines that are going out every day, and including some of the additional days that we can open up these clinics. So we have all these clinics strategically located in various parts of Windsor-Essex, and with the anticipated increase in the vaccine supply, our clinic will be ramped up to ensure that we are administering the additional doses without the need to move on to the next week, and we will be using almost all of the doses in the timely manner before we receive the next shipment.
Thank you.
Any questions from AM 800?
Teresa, just going back to the current cases that are active, you said 482, but the YouTube feed says 452. Which one is it?
Okay, let me just check that. I see 452, you're correct.
452? Okay, perfect, thank you.
Sorry about that.
And then talking about the vaccine rollout, not sure if you have all this information in front of you, but as of right now, who is eligible in Windsor-Essex? Obviously 40 and over, like you mentioned, in the hot zones, 40 and over at the pharmacies, and then we got at-risk, high risk, and then obviously long-term care and some essential workers.
Okay, so you did a good job summarizing it. So that's basically what you said is correct. So people that are 40 years of age and older are able to get the vaccine through a pharmacy, number one. So that's the age criteria for pharmacies. So if a participating pharmacy has an appointment, people 40 years of age in the general public can get the vaccine. If you are 40 years of age and older, you are now eligible to get the vaccine if you live in a hotspot postal code that I outlined. As well, if you have an at-risk medical condition, 40 years of age and older. So that's the 40-year-old group. Other people that can get the vaccine continue to be the healthcare workers, no matter what age, and people, of course, depending on the vaccine. So with Pfizer and Moderna, it's either 16 or 18 years of age. And anyone with a highest risk or a high-risk medical condition of those ages that are eligible to get the vaccine over the age of 18 or 16 are eligible. And the other group, no matter what age, would be the licensed childcare workers, based on that they're now eligible for a vaccine at one of the vaccination clinics. And for the general population, at a mass immunization clinic, if you have no other priority that is assigned to you and you're just a general public person, you would have to be 60 years of age and older. That continues to be the age across all of the vaccination sites. I know it's very confusing, but we are trying to adhere to the provincial prioritization, and as Dr. Ahmed said, use our local data to move forward, fill all of our spots. As you identified yesterday, there is availability, and it makes us look very closely at what groups we can open. And if we're not able to decrease the overall age group, we have to look at the prioritized groups. And as we get more vaccine, we will be functioning, providing vaccines across all three of the vaccination sites, well, actually including Windsor Regional Hospitals downtown and the Sportsplex. That's 5 options for vaccination through the vaccine clinics. and then again, the pharmacies that are in our area, and we hope to provide them with some vaccine as well, so all of the vaccine can get utilized. And in addition, anyone that attends a primary care provider, they would be able to provide vaccination to those, again, in the hot spots and those with at-risk medical conditions that are part of their rostered clients as well.
Perfect. Thanks for that breakdown. Like you said, I know there's a lot of information there. It keeps on moving, so I thought it was important just to ask that question today. Thank you very much.
Any questions from CTV?
Yes, good morning. Just wondering, were you hoping to see an overall age drop as well? I know it's good news to have the 40 plus in the hot spots, but what about as far as the overall community? When do you anticipate that age dropping?
Well, I can start. I don't know when we anticipate it, but we will follow, the direction of the ministry. It's none of this is done without consulting. And I think it just makes it a little easier as I'm identifying all of the different categories. As you know, if you drop the age, you capture everybody at some point. And as Dr. Ahmed said, our intention is to get everyone vaccinated, with a COVID vaccine if they want it. But decreasing in the age band would be helpful. But we continue to look at our coverage, and we'll advocate for local solutions, and we'll hopefully be able to decrease shortly.
Okay, and when do you anticipate the second doses beginning for the first group that started to get vaccinated, like the 80 plus or the residents of retirement homes, that type of thing, for second doses?
So the residents of retirement homes have always been eligible to receive their second dose. So people that are in long-term care or retirement homes are already receiving first and second doses. So we're have been maintaining that schedule. The people to start second doses, we know that through the Sportsplex, that some people will be eligible for their first doses in the first week of June. And we are working on the booking system, and that will come out shortly. We will do many channels of communication so people are aware of their second dose. So I don't want people to be worried that we have forgotten them in all the busyness of vaccines. We are aware of the need to start second doses and the scheduling of second doses. And based on some of our mass immunization clinics, it's toward the end of June, but we do know that with the Sportsplex that they will be starting probably early June, and we're working together on a common communication strategy that will go out, and it'll be kind of a rolling communication strategy, alerting people that you're eligible, please go online and book. And so you'll hear more about that in the coming, I would say another week or so, and we'll get that information out so people aren't concerned, but there is time.
Okay, great, thank you.
Any additional questions from CBC?
No, thank you.
Any additional questions from Blackburn?
Yes, you mentioned about the pharmacy program. Do you know if appointments are still booking up at local pharmacies? Is that still, a way of people get vaccinated, or are people kind of waiting for the Pfizer, Moderna vaccines?
Our uptake in Windsor and Essex County and across the province has generally been very good. We do not have a lot of vaccine in our pharmacies, so people are getting vaccinated and taking the first opportunity. So you do have to go online and use our website to, identify the pharmacies that are participating and actually call them. But right now they are using the remainder of what they have with AstraZeneca, and it's not a lot in Windsor and Essex County, so people are encouraged to keep trying to get that dose of vaccine.
Any additional questions from the Windsor Star? Any additional questions from AM800? I think we lost everyone. Okay, well, I guess we'll call an end to today's YouTube session and
Okay, we lost all of our journalists.
have a good day.
Thank you.